I'm going to hand across in a moment to our out of hospital cell lead, and that's Bryony Sloper. So Bryony, I'm going to hand across to you.
Brilliant. Thank you so much, James. And thank you everyone for joining today and giving up your time. So this is a winter readiness webinar for care home providers. And this year we have taken a joined up approach with all of our key partners, including social care and commissioners, in order to provide a combined package of information that you can access in a single place. And the website link is on that slide. As James said, we'll be sharing all of these slides with you afterwards. So don't panic about writing things down, etc. They'll all be sent through. And we wanted to provide one central place so that I'll just ask everyone to go on mute. Thank you. So one central place where you can access the most up-to-date information in terms of winter readiness. Next slide. So in terms of today's agenda, there's a lot of information that we're going to cover. We've got some amazing speakers and subject matter experts talking to the different areas. I'm just going to give an update on the enhanced health and care home framework and the priorities and where we're focusing. Then we're going to have a section very specifically around flu, no surprise there, in terms of outbreak management, but also vaccinations. We're going to talk about prevention, which will cover elements like NHS mail, the recognising the deteriorating patient, safe admission management to your home. We'll look at clinical support and how you can access clinical support. And then we're going to have some time to do a question and answer session so that you can put questions to the various speakers, and anything we can't answer there and then we'll summarise and email out to you after. Next slide,
Delegates,
please.
can I just, sorry to cut in, Bryony, can I remind all delegates to go on mute, please?
Brilliant, thank you. So in terms of the enhanced health and care home framework, if we go to the next slide. So I'm sure you're all very familiar with the framework, and it was updated in March this year. So the areas in red are the extra elements that were given a new focus for care homes and social care and primary care to support. You'll see a range of things there, including wound care and oral health care and falls. So in terms of the new framework, everything is listed there. If we go to the next slide. Then COVID-19 came and changed all of our lives and changed our priorities in relation to how we support care homes. So we focused on rapidly rolling out NHS mail. We focused on implementing the National Capacity Tracker tool, and really focused on recognition of hypoxia in the elderly and how we would deployed pulse oximeters to every care home provider, and obviously the digital agenda alongside NHS mail, iPads and other ways of being able to communicate with primary care and relatives, etc., using digital technology. Going forwards, we're going to be focusing particularly on implementing the weekly care home rounds and how we make those effective and as accessible as possible for you. Also supporting more training on recognising the deteriorating patients, working with the foundation dentists to make sure everyone can access dental care for residents, and taking a real quality improvement approach, working with the Patient Safety Collaborative. So that's just a headline summary of, as a region, what we want to make sure we're supporting you all with consistently, working with all of our partners. If we go to the next slide, because at this point I'd like to hand over to Catherine, who's going to introduce herself and talk to you about flu specifically. Catherine, are you on the call? So Ezra, Are you able to cover the flu slides, please?
Yes, I am. Hi, I'm
Many
Ezra
thanks.
Kunimo. I'm the Enhanced Health in Care Home lead for London. While we're waiting for Catherine, I will take you through some of the slides. So hopefully she will catch up before I finish. So we know that flu affects between 5 to 15% of the worldwide population. And we know that it usually causes mild illness in healthy people. But in the kind of residents that we have in care providers setting, we know that flu can kill, and we know that it's killed up to 11,000 people, and care homes tend to be disproportionately affected. We know that anyone can contract influenza, and being healthy doesn't protect against infection. So for those at risk of developing complications, infection can make their conditions worse, like the chronic conditions. It can result in people being hospitalized, sometimes even death. And we know that the over 65s tend to be the group which are at high risk, and the people with long-term conditions like asthma, diabetes, heart diseases, and those people who are pregnant. And for people with diabetes, they are 3 times more likely to be hospitalized if they were to catch flu. And we know that the best protection is flu vaccine, and it's easily administered, and it takes 2 weeks to provide protection. And we know that the viruses have great capacity to mutate and change. So a new vaccine is made every year to protect against the current strains, which is why every year we encourage people to get their jabs. Next slide, please. So this slide kind of just tries to show you how similar COVID and flu are, and also how they can happen at the same time with other transmissions. And we know that the COVID transmission may spike in early autumn, but we also know that it can circulate with flu at the same time. So we just wanted to make sure that people realize that this year the challenge is when you initially get flu or COVID, it might not be easy to work out which is which. So in terms of people being protected, we're just wanting to encourage that people get their flu vaccines. Next slide. Next slide, please. Some people might ask, why should they be vaccinated? And we know that in 1920, we had about nearly just under 3,000 flu outbreaks in care homes, and 70% of those outbreaks were in England. And what was interesting is less than a third of staff were vaccinated for flu last winter. And we know that, as we said in the previous slide, that flu, even if you're healthy, you can also be spreading it. And because you work in care home setting, the chances are if those who are vulnerable catch it, it can be quite fatal. And some of you will be already aware of this short film, which was done by Saturn, about the challenges of outbreaks, which results from flu, which can impact staff and residents. So we just wanted to reinforce the idea that the flu vaccine is an extension of the PPE you've been using to protect yourself and others. And by vaccinating staff, you're also protecting the people you look after. And by getting vaccinated, you're reducing the risk of flu outbreaks in the care home. And we just want to make sure people get vaccinated, as it will also protect yourself and your family and possibly co-infection with COVID. I noticed that my colleague Catherine is joined, so I will leave the next slide to Catherine. Catherine, if you're there, can you pick up the next slide, please?
Sure, absolutely. So as Ezra has just said, the flu vaccine is incredibly important this winter season. because we have COVID-19 co-circulating with flu this winter season, and we're not really, there's great uncertainty on what it means to have co-circulation or indeed co-infection with both COVID-19 and flu. So an important thing to do too is by having the flu vaccine is that flu is something that is within our control. We have a vaccine for it. We have antivirals that can help treat it. By vaccinating yourself, you are protecting not just yourself, but also the people within your care, and you are reducing greatly the burden of influenza on the health services. The health services do need to be able to focus on COVID-19 this winter season, so we need to do our best to ensure that they're not wasting their time, so to speak, looking after people with flu, which could have been prevented with the flu vaccine. There are lots of myths that go around about the flu vaccine. The flu vaccine is an inactivated vaccine. It is safe. You cannot get the flu from the flu vaccine. It's an inactivated virus. It's deadened. It cannot cause flu. Some people will feel a little bit sniffly or a little bit, have a bit of a temperature, a bit flu-like after having the vaccine, but that is just showing you that your body is actually reacting to the vaccine and is actually producing the immunity that you need to protect yourself against influenza. And it can take up to about 2 weeks for the flu vaccine to actually work and protect you. And sometimes people can acquire a flu within that period, and then they think they've got it from the vaccine, but actually no, you had already been exposed to flu, you were already incubating it before you got the vaccine. Other people have said to me, you know, why are we having a flu vaccine when there's only 4 strains of the flu vaccine, of the flu in the vaccine? Well, they're the main 4 strains that are predicted to be in circulation. So by having that vaccine, you are greatly protecting yourself from these 4 main strains, 2 of which are really, really deadly and can cause severe illness and deaths in our elderly population and our vulnerable populations. Also too, by having the flu vaccine, even if you do get infected with a different flu strain, the flu vaccine will actually make the symptoms a lot milder and you will recover a lot quicker. So it's a very, very good thing to take. As always, there's always these sort of silly stories that are out there, but at the end of the day, you need to have the vaccine, not just to protect you, to protect your colleagues so that they don't have extra work if you're off sick due to flu, but most importantly, you've got vulnerable patients under your care and you need to take it to protect them so you're not the person spreading flu, that you're interrupting the transmission. The targets are this year 75% for all care home residents, 100% for care home staff. This is more ambitious than any other year. There is a great spotlight on the programme this year. We're doing lots of work across London to try and ensure that we get that uptake across London. And these are just some of the work streams that are going on at the moment to try and do that. Next slide, please. What's really, really crucial really is that every care home should really take some responsibility around this. It's good practice, it's best practice to have somebody identified as your flu lead within your care home. And this person should keep a record of the staff and the numbers of residents and a record of the numbers who've been vaccinated. This is not only important for us trying to see what proportion of care home staff and residents are vaccinated, but in the event of a respiratory illness outbreak within your care home, one of the questions you will be asked will be around flu vaccine, and this will save so much time if you actually have these records at hand. We have, sorry, there's all these emitting people popping up on the screen. We have, it's in the care home, the framework for enhanced health in care homes. This best practice of having a member of staff identified with responsibility for running the flu immunisation campaign and keeping the numbers, and this person to champion the importance of flu vaccine within the home. Flu vaccine is just as important as the other measures that you're taking, like PPE, social distancing, deep cleaning of the premises. Really important to have that vaccine. There are resources available which can be downloaded from the Public Health England Campaign Resource Centre. If you don't have that link, I'm sure we can circulate that for you, or you can Google Public Health England Resource Centre and they're very, very receptive to any queries, and also very happy to send out any leaflets or posters or anything that you might need. Next slide, please. So where can you get your vaccine? Well, all care home staff, you can get it in your GP. Just tell them that you're a care home staff member. You are eligible, they should vaccinate you. Or you can go to your local pharmacist and show them your badge, or tell them you're a care home worker. In the pharmacist, we have extended it to non-healthcare care home staff as well. So cleaners, maintenance people, etc., can get their flu vaccine for free from any participating pharmacy across London. And to find out who's participating and who can give you this vaccine, you can look at www.myvaccinations.co.uk. It is a good idea to try and vaccinate your staff and your residents all in one go. This can be arranged by community pharmacies. Not all across London will be able to do it, but many can. Also, to your local primary care network has responsibility around this, and they should be organising, or you can liaise with them. Please do ask them to organise some pop-up or some mobile vaccination units to your care home. It makes it so much easier to have everyone vaccinated in one spot. And while I'm speaking about vaccines, if any of your residents have not yet had their pneumococcal, you can have that dovetailed with the flu vaccine. And equally, if any of your residents are 70 to 79 and haven't had their shingles, you can also have that given at the same time, just to let your PCN or your GP who looks after you that you want to have that. And the other thing is agency staff are also covered. So if you have any agency staff, they too can get their vaccine, and they can pop into, again, any of the participating pharmacies to get that vaccine. Next slide. There are ways, and we will be looking for data on the uptake in every care home. So to make things easier, there are ways to do this for you, and there is a vaccination tracker that South West England have used, and that has been, it's an Excel spreadsheet, but very easy to populate, and it'll keep a track for you, and it'll tell you what proportion of your staff are vaccinated. So it's a nice way of keeping a record, and this can be completed and managed by the care home and then shared with the CCGs, who will share with us here at NHS England how you're doing. And it's really important that we do keep an account, because every year we have outbreaks of flu in care homes. Care homes are very vulnerable, so if we can greatly reduce that at a time of COVID-19, that would be really, really appreciated, and a really good step into protecting our population. Next slide, please. Oh, that's me, all done. Thank you.
Thank you so much, Catherine. That's brilliant. Just to remind people, please do put questions in the chat as we go, and we'll pick those up at the end when we have time for discussion. So I'm handing back to Ezra now, who's going to talk around managing outbreaks.
Thank you, Bryony. Just to pick up one point on the slide that Catherine mentioned about collecting data. I think one of the questions that came up before was, what would managers do if staff were to decline a vaccine? I think the tracker we've given you will allow you to record the reasons if staff were to decline the vaccine. I just wanted to point that out, but I'm sure we can say that a lot more if we with the FAQs that will follow later on. So the standard operating procedure, or SOP in short, is a document which is a step-by-step instructions to kind of support people to carry out complex routine operations, and in this case is about how you manage an outbreak. And in the SOP we're going to be sending you, it will contain roles and responsibilities for the registered managers, the residents GP, the health protection teams, CCGs, and local authority and community providers. So the SOP would just be there as a tool to help you to manage things. So this year, what's the different from other years? Next slide. Next slide, please. I think you've jumped one, but you might need to go one. Yes, thank you. So this year, early testing will be quite important. And another thing which we've already mentioned in the previous section was COVID and flu are going to happen at the same time. So we've tried to make sure in terms of management, testing will be key to determine whether an outbreak is due to seasonal flu or is due to COVID, and then that will allow the administration of medicines like Tamiflu. The resource pack, which I'm sure most of you will know about by now, is also got lots of information around testing, which will help you to manage this in terms of testing and what you need to be doing. For example, top tips for swabbing residents. How do you manage residents with mental capacity challenges? Next slide, please. Most of you already know about this one. This is just a reminder of what you need to do when an outbreak happens so that you're prepared, because there will be lots of information that will be required. So we just wanted to remind you of that. Next slide, please. In terms of what happens when the flu outbreak occurs, we obviously want you to contact your resident's GP or to go to Starlines. And then if there's a suspected case, we would expect you to contact your local PHC team. In this case is the LCRC, and the numbers are provided. And you also find this information in the resource pack. And then if urgent clinical support is required, we'll still encourage you to use the Starline numbers, which we'll talk about a little bit more later on. Next slide. We obviously know there will be other outbreaks like the diarrhea and vomiting, the norovirus. So we just wanted to remind you again that just continue to follow your infection control procedures and continue to do what you've always been doing, the fantastic job of managing infections and outbreak. Next slide, please. Next slide. I think we're probably having IT issues, so bear with us. So one of the things which will be a challenge with outbreaks is home visits. So this is an example of what we have in the resource pack currently. We are working on updating this slide at the moment. But one of the things we wanted to highlight to you guys is to make sure that you continue to review your policies and you continue to liaise with your local authority in terms of what's expected of you in terms of visiting and if there are any restrictions that have been put in place. I'm not going to labor too much on that, but this will just help you to remind you while you're managing the outbreaks, you also need to think about how are you managing the home visits, because visits can also be important for some of your residents. Next slide, please. And the last slide is just a reminder of the importance of record keeping in everything that you're doing. And next slide.
Wonderful. Thank you so much, Ezra. Again, a reminder, please do put questions into the chat box and we can answer them as we go and pick them up at the end when we do a Q&A session. So I'm going to hand over to my colleague Dan to talk about accessing clinical support into your care home.
Hello. Okay, on to the next one. Yep. This is fairly straightforward. Every care home should have a lead practice through the primary care network, its local primary care network, and through that there should be a clinical lead for the care home. Now, if we didn't have COVID-19, that clinical lead would need to be a GP, But in the case of COVID-19, and it says it right in the box at the bottom, that doesn't necessarily have to be a GP currently, and there are cases where it's been agreed across the board by the practices in the PCN, the CCG, the relevant community provider, and obviously the care home as well, that it could be somebody else, for example, someone from the community or another clinician from within the practice. And really the main point on this slide is about the fact that the role of the care home's clinical lead is predominantly about oversight, ensuring that the service, the clinical service to the care home is delivered, and it's about pulling together the different parts of the system, for example, through the weekly MDTs and care home rounds, and kind of making sure that the link is really strong between all the different parts of the primary care and general health system with the care home. I'm not sure there's much else to add to this slide, I'm afraid, so it might be on to the next section.
Thank you, Dan. And again, I would ask people, please put your questions in the chat. If you've got any questions around the clinical lead, do you know who your clinical lead is? Have they contacted you already? Are you in touch, and are they in reaching? Do let us know. So moving on to the next section, and my colleague Jane is going to start this section off, but a few colleagues together will cover the content. Again, there's a lot of content here. It will all be emailed out to you separately when you get a copy of the recording and a full set of the slides. Thank you, Jane.
Hi everyone. So I thought we would start with just covering, I'm sure many of you spent the weekend reviewing the COVID-19 winter plans, but what we've just done is brought those very simply out onto a slide, just to kind of allow you to look at a high level as about what is the ask from care providers over this year. It is really interesting to have a read of it because it also outlines what your expectations should be from the national team, but also your local support from your CCGs and local authority. So the link is there, have a look. If you've got any questions, your CCG or local authority lead should be able to help you, but equally, please do get in touch with us if you have any questions. Next slide. So what we've been doing through this Connect session is looking at what we thought we needed to bring out to have a little bit of a conversation. So we're going to focus on infection prevention and control, PPE, so your personal protective equipment, a good conversation around digital, some conversations around admission and discharge, and are you concerned about a resident? So recognising those signs of deterioration and acting appropriately on those. Next slide, please. Hopefully most of you will have seen our London Care Home Resource Pack. As Bryony said at the very beginning, we've worked with health and care providers and partners across London to bring together a resource pack that really helps you to navigate your way through some of the national policy and guidance with some local information around what's happening with us. So there's lots in there: testing, recognising the signs of deterioration, end of life care, working with your MDT. And it is constantly changing. So when we do have any updates to national guidance or policy, we are trying to change that pack. So there will be something that comes out on a regular basis, but it's now on the website so you can access that, and we'll put the link into the chat as well. But we would really like your feedback. So if you're reading it and you think, actually, I'd really love to see this in there, or that's not really what's happening with us, please let us know, because this is your pack to help you. So we really appreciate your feedback on those. Next slide. So your infection prevention, control and PPE. Now, a lot of this is going to be what you're living and breathing, but it's just a good thing to just remind your teams of the continued importance of hand washing, social distancing and using your PPE. There's lots of resources that are out there, and it's also kind of like there's some great resources on the NICE, so the quick guide for managers and staff in care homes, helping to prevent infection. That's all still incredibly relevant for COVID, as it is the flu or norovirus in any kind of like situation. So make sure that you have those information available. It's got a lot of your kind of like your frequently asked questions, but again, there will be somebody locally that can help you navigate through those if you've got any challenges. Next slide. let's get digital. So this is one of my passions. So we have been doing a lot of work, and I think you must have been in a hole somewhere if you haven't heard about the work with NHS Mail. I would like to say a huge thank you to care providers for the engagement that you've done with this. From the beginning of March, we've onboarded, there's over 20,000 social care providers and their staff that have got email addresses, and that's incredible. So you didn't have that at the beginning of the year, many of you, so to actually have that now is just fantastic, and I think hopefully it's opening some doors and making you feel less isolated with those communications. So Alice is going to go through NHS mails, but we've got Microsoft Teams, your video conferencing, but you may be using something different. So if you're using something different, pop it in the chat, because we'd love to hear how you're using digital technologies within your care home. But what else is happening to support you delivering care to your residents? So Bryony mentioned about pulse oximeters, and you may have thermometers, but you also might hear over the next 6 months about remote monitoring. And this basically means that with either your pulse oximeters and your thermometers that you've got already, or very whizzy Bluetooth devices, that you actually are able to input information, both your soft signs of deterioration, but also some clinical observations if you take them within the home, and allow that to be seen by your team. So your GP, your community services support team, they could be seeing what's happening with your residents, which hopefully will really help some of those conversations around your home rounds, and if you did need to escalate any concerns. There's loads of help that's available. Now, Alice will tell you kind of like how to get in touch with our team, but digital social care, please have a look. That's a dedicated space that is for you, provided by the sector, and that's continually being updated with good resources, how-to guides, good practice. So yeah, please have a look at digital social care. Next slide. And over to Alice for now this one.
Hi everyone, I'm Alice. So I've probably spoken to a lot of people before. So I'm leading the work on NHS Mail rollout across London. So as Jay mentioned, there's been amazing engagement on this, and we've got over 80% of care homes up and running with NHS Mail now, and about 30% of domiciliary care, which is amazing. So you've probably all seen, a lot of you have already done this, but just a reminder, the fast track service for signing up to NHS Mail, which was put in place over COVID, is still running. So you just have to complete a really simple form with a couple of details about your organisation and also who you want to sign up. So just submit the form to that email address there. So that email address is a dedicated email address for any concerns, queries about NHS Mail. So after this, if you have any questions or queries, please do get in touch and one of the team will get back to you. And then this bit at the end is really important, so activating your account. So we've got quite a few providers that have signed up but haven't activated their accounts yet. So if you need any support, advice about that, again, if you can email that email address and we can help you activate your accounts and get using it. So if you're already signed up, so how to get started using NHS Mail, I've had some amazing conversations with care home managers about how they're using NHS Mail and how what a difference it's making. And these are just some pointers if you're just getting started on who to start contacting first. So an easy one is emailing your GP. So I think that's transformed quite a lot of ways of working. With emailing your GP and asking for information, emailing your local authority. So if you've got an nhs.net email address, you can email gov.uk and that's secure. So I know a few local authorities are looking at transitioning over to communicating with their care homes through nhs.net. So it's a really good one to get started with, and also your community teams and hospitals. So if you've got a resident that's come back from hospital and you don't have the discharge summary, you can call the hospital and they can email that to you because you've got a secure way of receiving that information. If you want to know any more case studies and see how other care homes across London are using it, again, let us know and we can send you through any comms we've got on that. And just to say, this also allows you to start looking into other digital tools that are being scoped up. So proxy access, the online ordering system for repeat medicines, looking at virtual assessments and also remote monitoring. Next slide, please. So previously, before COVID, in order to get an NHS mail address, you needed to do the Data Security and Protection Toolkit. So it's the old information, it's the new Information Governance Toolkit, and it's just looking at how you deal with data within your organisation. So this was waived, so you haven't had to complete it for NHS mail. What we are asking you all to do is to register for the DSPT, and we put the 4 really simple steps that you need to do. That is all you need to do. You don't need to complete the DSPT at all, and we will revisit that once the support and guidance is in place to help you get through that. But for now, all we're asking you to do is just register for the DSP toolkit. Okay, any questions on that, just email the previous slide. Next slide, please. I'll hand over to Dan.
Hi again, I'm back. So this one is just about capacity tracker, which I'm sure will be familiar to everyone on this webinar. Capacity tracker, if you don't know, it's a tool that care homes across the country are being asked to fill in, which provides where the care homes provide on a daily basis information on their capacity, as it kind of says on the tin. But also a whole host of information about business continuity, about COVID, and soon to be or already flu information. It has a really helpful resource centre. So as well as the fantastic resource pack that London has put together, there's a whole host of information. But really, the reason it's such an important tool, and it's really important for care homes to be filling this in every day, is because the information that you provide helps your local authorities, your CCGs, and also the national the national NHS and local authorities bodies to help to plan. So the better an idea they've got around your business continuity, your capacity and bed vacancies, and how you're coping around COVID and flu, the more they can do to put support in. So yeah, just really urge you to keep on. And I know that there's been a fantastic response in London to making sure that is filled in on a regular basis, and just urge you throughout the winter to carry on doing all that great work with it. So next slide. And this really is about how you can access urgent senior clinical support within your care home. So it's a way of using the NHS 111 and following the instructions on the right. So NHS 111 *6 to access a quick callback from a senior clinician, rather than having to go through the perhaps slightly longer route of trying to go through normal 111 and hoping for the best. It's a really helpful resource. We get feedback from users of the number who say that it's helped to avoid hospital admissions. It's helped to get faster access to medication and such like. And so really just recommend, especially now, we as much as possible, we want to try and help you to get the clinical support you need to support your residents in the home, rather than having to take them into hospital or get an ambulance out, where the risks are now higher than they ever were. So please do make use of this really helpful service. Next slide. This is a helpful resource when we send out the slides. You'll be able to click on the link at the bottom, and also I think if you click on the picture of the poster, it takes you to a downloadable version of this poster. And really it's just about working with your CCG, your PCN clinical lead, or your GP, to make sure that staff in your care home know all the relevant contacts to get in touch with in your local area, should you need to escalate a clinical issue with a resident there. And it's making sure that the information that you've got is as locally up to date and relevant as possible. And really what we urge you, like it says in the little orange bubble here, is to work with your local system. You know, reach out, don't be shy, don't wait for the information to come to you. Just get in touch with them to make sure that the information is correct, because if you don't have that information, you know, you won't have the right contacts locally. Yeah, so that's next slide. Admission and discharge. Obviously, there's a lot of concern about accepting and admitting people into residents into your home who have been discharged from hospital, and it's very important to recognise the vital role that care homes have played in helping to accept residents back from hospital. What we've got here is kind of a summary from the current national guidance. Obviously, that may change over time, but this is the most up to date. And you'll see at the bottom the link to the resource pack, where if that guidance changes, we'll reflect that in the resource pack as soon as possible. So what I'm going to tell you now is as up to date as possible. So for all admissions to the care home, they're going to need to be isolated for 14 days. We'll come back to that on the next slide. But before we go to that, they should be swabbed 48 hours before they're discharged. But if you don't have the result, it's still safe to accept the resident into the care home, especially if you're following the right the right procedures for isolating and infection prevention control. And really, a key point is to work with and communicate clearly with the hospital discharge service and staff to make sure that you've got the right information. So what is the COVID status of the individual? Have they had any symptoms during the process, you know, whilst it's been determined that they're safe to be discharged? And have you followed the right risk assessment steps? And we've got a link to the templates there. Next slide.
Dan,
yeah.
2-minute warning.
Lovely. And this is just about if you have concerns, if you don't think that you have the space to isolate someone who's been discharged from the hospital, just making sure, have you got a side room with an ensuite? If you have, that would be adequate. And if not, to reach out to your local authority and your local CCG, who should be able to help you to find an alternative to provide that isolation provision for 14 days. And again, there's a link at the bottom to the resource pack for more information. Next slide. This one's about supporting care home staff wellbeing. It's been mentioned, I've seen lots of mention on the chat about the care provider workforce risk assessment, which we've provided the link to on the Healthy London Partnership website. You can watch the webinar and see the slides. Also within the care home resource pack, there are a couple of slides with lots and lots of links to further support, further information, and where you can find out more about supporting care home staff wellbeing. There's been a massive increase in the provision of what's available. I'd also recommend, as well as the information on this slide, which we'll be sending out, using a system called Good Thinking, which has plenty of information and signposting and where to get urgent support as well. Next slide. And this one's really just a winter checklist, which again, you'll get in the slides. So the actions from this section: have you registered for Capacity Tracker? Are you using it regularly? Have you got NHS mail in your home? And are you using that regularly? Have you been using the star lines? Do you know how to access it? If not, check the slide. It will show you how to. Have you reached out to fill in the information, etc.? You get the gist. It's all on this slide and the slides before. So thank you. Next section.
That's wonderful. Thank you so much, Dana. An awful lot of information there, I realise, for people to take in, and you'll have the full detail sent out to you after after we finish the webinar. James, I'm going to hand over to you to go through the questions in the chat, please.
Thanks, Bryony. Yeah, we've had some really good interactions, so I'm going to go through those in the order we received them. The first question came from Karen and Vida, from colleagues from Manor House. Excuse me. And it's worth going through. It's quite a long question, but I think it's a good one that maybe Catherine can pick up. So they were asking if the flu vaccine can be provided directly in care homes for care workers in their setting instead of going to GPs. They explained they contacted their local chemist. The chemist said they could give the flu vaccine to other GP surgery where residents are registered, and then the nurse could come to administer it. However, the chemist also asked if they can get paid for the flu vaccine for staff. So could one of the panel pick up on that and see if that circle can be squared at all?
So is the question about if the pharmacist was going to get paid for vaccinating staff?
I think it was twofold, Catherine, and please, Karen and Vida, tell me if I'm wrong, but I think the question was, can it be provided on site, and then how would the payment work, I think?
Okay, yes, it can be provided on site. I mean, ideally getting your local, if your pharmacist has agreed to do it, if they can come in and vaccinate all staff and residents, that's absolutely fine. They are contracted to do so. They get paid for that under their contract with us. And all information on the vaccines given will be sent to the GPs of the registered patients, and also to where the staff are registered. So that's my very long-winded way of saying that yes, they do get paid. They're contracted to do so, and the system is set up that the information does go back to your record at your GP.
Thanks ever so much, Catherine. That's excellent. Hopefully that picks up on the questions from Karen and Vida. Second question was kind of twofold. Mercy B. Carey dropped a question in, as did a colleague from Coppermill. So from Mercy, she was asking, what if staff do not want the flu jab? And colleagues from Coppermill extended that a bit further to say that their staff are very against having the jab. And was there a kind of simple information sheet that they could perhaps share with staff to kind of extol the virtues of getting it done and all the good reasons why? Who might want to pick up on that? Jane, I can see a hand up from you. Or are you asking a question?
Sorry, on mute there. And one of the things that I would say is actually showed in the video that Ezra's mentioned is that the impact on those members of staff and their families from actually having the flu. I don't think there's anything better than hearing it from people who've actually been affected. And actually one of the stories which is really great on there, not great because obviously she experienced it, but she's actually saying she never had the flu jab previously. And when she got it, it was a huge impact for her family, and actually that she would definitely recommend having it again. So there are resources that are available. We'll make sure they're in the resource pack, but we'll kind of like make sure that they're highlighted to you. But yeah, share the video, have those conversations with people and work out what worries them. And some people will still say no, but if you can put across as much as you can why this is important when flu and COVID is circulating, you may be able to have a slightly different conversation.
Thanks, Jane. And I know that you guys have been talking to us in the comms team about creating some simple stuff for domiciliary care workers. Perhaps we could amend one of those slightly, as if people wanted a simple kind of list of pointers. That might be helpful too. I'm sure we could come up with something in addition to the video. And another question coming from Pep, and I think it's been answered, but I think it's worth addressing it here. Pep was asking, is the flu jab compulsory? Now, I think the answer is no, but did anyone want to expand on that at all? Is it simply a case of, again, just going back, winning hearts and minds as to why people should have it?
Yeah, it's not mandatory. There are discussions nationally on this. It hasn't come in for this flu season, but it's quite likely in the future it will be. And to add with what Jane had said about the video, which is really, really good, if there are any difficulties, do just drop us a line. We've got a generic email address, which I'll put into the chat. And we can always arrange for some training or some talks. We've done it for Trust, and we can do it to help with the myth busting. And we also have 7 Steps to Success, which has worked in the trusts in helping get uptake. So we're happy to circulate that as well. But there are ways to help you.
Brilliant stuff. Thank you, Catherine. And I think someone's helpfully just put the link to the video in the chat. So I would urge all delegates to go through the chat after. There's a lot of really useful stuff going in there, including the links to the risk assessment webinar and slide pack from last week, and the resource pack is in the same area as well. A nice mention on the way past from colleagues at Callum House, who simply commented to say that their CCG is lovely and contacts them every week. So that's always good to have a bit of feedback there. Another question we've had in, Anthony, I'm going to have a go at your surname. I'm probably going to get this wrong, but I'm going to go with Ugwugbulum. I'm going to go with that. Say it quickly and hopefully that's vaguely near correct. Anthony's asking, is the COVID-19 vaccine now available for care home residents and staff? Is that too broad a question for the panel to be able to answer specifically? Or?
I think that the answer is it's not available for anybody as yet. So
sorry, I do apologise, Jane. I was reading that as the flu jab. Sorry.
No, that's absolutely fine. No, but I think just be reassured that obviously the care home residents and staff are going to be a high priority on this to protect your residents over the next period. So again, watch this space, keep in touch with your CCGs and your local authorities. They will be the first to be able to give you that information.
Thanks, Jane, and thanks for saving my blushes. If anyone does have a cure for COVID, do let us know. Okay, just scrolling back up through the chat, I think that's taking us to the end of any questions we've had in. As I say, please do check through the chat. There's a lot of really helpful links. We'll be looking to share this presentation, recording and slides tomorrow, but I'm going to hand back to Bryony for closing remarks if there's no more questions from anyone.
That's brilliant. Thank you so much, James. I just will call out another positive from Laura Archimeta, if I hope you've pronounced those right, where Jane asked what is going well. And you've put in the chat, staying COVID-19 free and having a great team which worked really hard to safeguard our service users and their colleagues. That's brilliant to hear. So thank you so much. There's a huge number of you have joined today, and thank you very much to my colleagues who've presented content, and also to the comms team for helping to host the webinar. So thank you very much. We will be sending out all of the details to each of you through the Eventbrite link, contact details you shared. And I think people have been putting their emails into the chat as well if you didn't join through the Eventbrite link. So that will all come out to you shortly, including a link to the recording. So in this final slide here, there's a number of core links to support with flu vaccination. There's a link to the flu video we were just talking about, and lots of other additional information. So that will come out to you. And I think there's one more slide, and then I will close and let everyone get on with the rest of their day. Or next slide, is there one further one? Yes, thank you. Thank you so much for giving up your time. Any questions at all, don't hesitate to contact us using our email. And thank you very much. Have